Caitlin. I'm a nurse here at Caldwell Memorial Hospital. This is our main entrance here where you'll come if you have a procedure scheduled with Dr. McGuire. We have visitor parking out front and on the sides. All right, so right through these doors is where you're gonna check in. We have our front lobby and registration area, so you'll check in for your procedure right through these doors. All right, so now we're heading up to level 2. All right, so this is our surgical center check-in area. So this is where you'll come to check in for your procedure. All right, so this is our PACU area. This is where you'll be recovering from your surgery. And we have some of the best nurses here to help you on your journey of recovery and help you get back home after your procedure.
All right, now we're in the bronchoscopy suite, and I wanted to show you what a bronchoscope looks like. It's a small tube that has a camera at the very end. It's flexible and allows us to move around your airways to get into different areas. We can pass multiple different tools through a scope like this, or our robotic scope, or our ultrasound scope, to access tissues that then we put underneath the microscope and try to find out what is going on. During bronchoscopy, there are 3 complications that can typically occur. The most important is collapse of the lung. If we're doing biopsies, we can poke a hole through the lung by doing forceps biopsies or needles, which can create collapse of the lung, or what we call a pneumothorax. If that occurs, oftentimes we don't have to do anything special. It will resolve on its own. But if it is large enough, we have to put a chest tube in and suck that air back out to get the lung to re-expand. Other complications would include bleeding, which is very unusual, usually in such a small amount that we can control it during the procedure, but rarely life-threatening. And then there's also the possibility of having a low oxygen level after the procedure. The oxygen level typically will return to normal within a 4 to 6 hour period, but it may take several hours to get back to your normal baseline. If you use oxygen at home, it's very important to bring your tanks so that you have oxygen available for the ride home.
We're the nurse navigators for Dr. McGuire.
So we will be here to help out with procedures that you may have at this hospital. You can ask us questions, and we will also be building your cases, giving you phone calls, keeping you up to date on what is going on.
So you'll either hear from one of us or see one of us before or after your procedure.
We look forward to seeing you.